Lifestyle medicine. I set my physiotherapy and Pilates centre up in Belgravia in 1994 with the ethos of bringing about lifestyle change in all the patients that walked through the door. And that was through education, advice, guidance and hands-on treatment so that we could get full resolution of their presenting condition. Rather than just treating the end result, which is the shoulder pain or the elbow pain or the wrist pain or the knee pain, we were looking at the physical and emotional causes of why they presented with this condition. And when we did that, we would often get full resolution of the problem, but also the patient was completely engaged with what had caused it. And so they brought about a lot of the change. We were the facilitators. We didn't just do things to people. We were the facilitators, and so they would get that full resolution. We're now in 2026 and we're still not getting enough lifestyle medicine within GP practices, within the NHS, within hospital settings. Dr. Rangan Chatterjee, and I know many of you will know of his podcast, Feel Better, Live More, and also his books that he's written. But he has done another programme for Channel 4, and I will give the link below. And he has taken 3 of the most common conditions that present to GPs, which are lifestyle-led conditions. He's taken chronic pain, which I'm of course very involved in, and we have treated many patients, physios do, with chronic pain, type 2 diabetes and depression. So I really urge you to watch that programme and really understand the power of educating patients so that they are empowered to make some changes themselves that will be lifelong. The other person that he has done a podcast with is Dr. David Unwin, who is a GP in the North, and he is a massive advocate for lifestyle change. And again, that occurs through education of his patients. And his light bulb moment came when he had a formidable female patient come to him and lay into him saying, "How dare you," she had type 2 diabetes, "how dare you not tell me about diet and the implications of bread, pasta, all these things which are starchy foods, which often convert to sugar, that would really aggravate her condition." It's a brilliant podcast, really important that people listen to it. And this is not to deny the benefits of surgery and drugs in certain conditions. But the first port of call with any medical consultation should be about educating the patient in their condition and making sure that they try and bring about some lifestyle change which can really affect their signs and symptoms and their condition. And then we can open up the NHS to what it really is for acute episodes, medical episodes. There are so many conditions that could be dealt with lifestyle issues. So listen to those programs. I really urge you to make any comments, please, about them, because this is a discussion that really we've got to spread the word. Those are people who understand this and get it. We really have to push this forwards a bit in every health walk of life, and also just not getting too bogged down in Instagrammers and influencers who are pushing certain supplements and this and that and the other. You know, basic health, basic nutrition, basic understanding of movement and exercise, understanding how important sleep is, looking after our mental health in many different ways of more social interaction, and us all having a life purpose in life, you know, is so valuable. And being part of a community, connectivity. I've just come back from church where I served coffee afterwards, and the community spirit there is extraordinary, and people come up to me and talk about things that are going on, and I can advise a little bit, and everybody is chatting together, and you're with this communion of people who have all different things going on in their lives. There are many ways to get that communion, but I feel very passionately about it. So lifestyle medicine, it's got to be the norm and not the exception.